The general observation chart is used to systematically record the patient's vital signs. To chart vitals on the general observation chart, follow these steps. Select the patient in admission. Click on Actions and select Inpatient Charts. On the menu, select General Observation Chart as shown. On the General Observation Chart window, fill in the required details. Input the date and time when the patient's vital signs were recorded. This timestamp is critical for tracking changes in the patient's condition over time. Capture the heart rate, respiration rate per minute. Capture the fraction of inspired O2, FiO2, which is the concentration of oxygen that the patient is inhaling. Capture the oxygen saturation, SpO2, %. The oxygen delivery mode captures the method used to deliver oxygen to the patient, such as a nasal cannula, face mask, or ventilator. Capture the temperature and monitor blood pressure, both systolic and diastolic, to assess cardiovascular health and diagnose conditions like hypertension. Select the sedation score from the drop-down. Indicate the pain at rest using the 0 to 10 scale. Indicate the pain with movement on a scale of 0 to 10. Capture blood glucose level. The total fluid intake, which is the amount of fluid, in milliliters, the patient has consumed or received via intravenous fluids within a specific time frame. Capture the total fluid output. Indicate the weight in kilograms. Indicate the patient's height in meters. Indicate the name of the nurse who performed the observation. This is important for accountability and traceability in patient care. Click on the Add button to save. Click on the Generate chart to print a plotted general observation chart, as shown.